So Ruth, this is a mode where you had a client that used to kind of use this consistently over the weekend, and they'd come into session and always get themselves into trouble. I'm Rita Unit. I'm a clinical psychologist, advanced schema therapist, supervisor, and trainer. And we are here talking about 7-minute schemas.
Yes, I'm Ruth Holt. Yes, I did have a client, and we're changing details, of course, but I did have a client who would get themselves into trouble. And we've really trying to workshop this. There were constant fights. People were attacking them. It sounded like not a world that I was living in. And so at one point I asked them to demonstrate how did they walk into, their supermarket? How did they walk into their post office where these blow-ups used to occur? And so they demonstrated, and it was very clear to me that I was looking at a suspicious over-controller mode. So in this mode, my client was very looking around, checking out people. There was a bit of an intensity to the gaze because they were being activated by their mistrust abuse schema, which was telling them the world is not safe. Nobody's safe. You never know when you're going to get attacked. So because they went into this mode and they're looking around in this kind of suspicious manner, that would actually probably activate other people with that mistrust abuse schema, and then it was on. So what is the suspicious over controller mode, Rita?
So in this mode, people are on the lookout for danger, for people seeking to harm them. They're on guard. And they will protect themselves from anybody trying to control them. And so really it's a mode around hypervigilance, isn't it? So the suspicious over-controller mode.
And it can even come out in therapy settings where perhaps the client might feel like, what are you trying to do to me? What's that question really about? Oh, I noticed you did raise that eyebrow. I know what you're thinking. So it can really make it hard to connect in a therapy setting because this mode will constantly be interpreting the environment and usually in a very hostile way. And where do you think, well, like what would be the kinds of environments where someone might learn that this is how I get myself safe?
Well, as you said before, Ruth, one of the main schemas driving this particular coping mode is mistrust abuse. So it would be safe to assume that most people who have this particular coping mode came from an environment where they were mistreated, they were abused, they were hurt by people that were not meant to do that were meant to protect them. And so by being suspicious of people's motives and having some control around that, gives them a sense of safety. So again, with all coping modes, they're survival strategies. So one of the things we want to ask is, how does this being suspicious give me a sense of control and help me survive in the world?
Yeah, so a child who's in a situation like that needs to be a meerkat, don't they? Needs to be on guard, hypervigilant, alert. And you can imagine what that would do to somebody's body, being that stressed all the time. And this is one of the key things that we want to help clinicians look at in therapy is how do we help clients to down-regulate all of that hypervigilance when they are actually in safe environments? Because often what's safe and what's not safe has become so skewed. We call that neuroception in the neurobiology literature, that clients have learned that nowhere is safe. And so particularly, I guess, in our complex trauma training that we provide for clinicians, we're really helping clinicians to work with the body, to work on reducing and down regulating that hyperarousal.
Yeah, and I think this is also a common mode in forensic patients. So not just, perhaps, we talk about it in our complex trauma, but of course, a lot of individuals who have a forensic presentation have also had traumatic histories. And I guess, again, you want to think about, just like with all coping modes, we're probably not going to get rid of it completely, but how do we do it in a way where the client's not getting into trouble on the weekends and coming into sessions and having all of these blow-ups, if you like, that maybe they're going to have more suspiciousness than you and I, but how can we kind of reduce that to the point where there isn't that distress on the body, and then recreating or reenacting things that occurred in their early life, that the world is dangerous. People are dangerous. They are out to get you.
And I think, for clients, it can be important to share that, so if you're sitting in therapy feeling like, I just don't feel safe, I don't know what you're doing to me, you're going to hurt me somehow, this would be a big thing, but I think an important test of the clinician to say, I feel very unsafe in this room. And a good clinician will be able to help you with that, will understand that, maybe be curious about that. And, because I think for clinicians, we might assume that everybody will feel safe in the room. And trust is something that needs to be earned. Now, there comes a point, I think, where this mode will kind of become a real barrier to therapy, because if we don't start to reduce it a little bit and build healthy adult safety, it's going to block therapy. At some point, it's going to say, I can't trust anybody ever, even if you're my therapist and I've known you for 2 years. So early on, we want to not assume high levels of trust, but we want trust to grow, and we want to teach our clients, how do you know when it's safe? How do you know when it's safe to trust?
Yeah, exactly, Ruth. And I guess one of the things, particularly in relationships where this plays out, is looking for indicators and markers of trust. Who is trustworthy? Because again, the scheme is perhaps going to, create the same patterns where we might pursue relationships or end up with people that reinforce that we're going to be abandoned, that people aren't trustworthy, they're going to hurt us, etc. So some psychoeducation around that. And we've got some lovely cognitive techniques that we talk about in our advanced workshop around how to work with this particular coping mode and mistrust.
So that's our 7 minutes, Rita. And if people would like to have more training opportunities, there's a link at the end of the video.